Lactation consultants are registered nurses who provide education and support for women who are choosing to breastfeed their babies. Monument Health Rapid City Hospital recently expanded its lactation facilities, and some of the funds raised during the CMN Mediathon will go toward those efforts.
We always say human milk, first step towards wellness. So if we can get human milk in humans, we can start the process of wellness. And it is so important that in our NICU we purchase donor milk every Monday that we can give to infants if there's not milk for babies per mother, or if they choose not to use it, we will provide that for them. So it is so important that we use it in our most fragile patients, the NICU babies. It is just such a rewarding area because when you get that baby to nurse, you know, that mom that has worked so hard, or the kiddo that's been sick, or whatever, once they get that nursing going, they're very, very thankful. And yeah, and it's, you know, it's a healthy area of medicine. Even if we can't get the kid nursing, we can oftentimes provide the milk for them. There's a million ways that this can look. Everybody's story is unique. There's lots of different successes, and people are very thankful.
The lactation department started small about 20 years ago and has expanded to its current area in the first floor west addition of the hospital.
But currently we have this big, beautiful area, so it's 3 outpatient rooms that are private, like this one. We also do birth planning, so we have a birth planning room where one of our lactation nurses meets with people pre-birth to make sure that we're trying to meet their needs. We have our desks are all, we're not shoulder to shoulder anymore. We've got some space. My biggest deal is supplies. We have a supply room. It makes our jobs easier. We can see more people. We don't spend so much time on non-patient duties, so it works out really well.
Some higher ticket items are the scales, particular to weighing babies before and after feedings, to gauge the milk intake, as well as computerized breast pumps.
I love nursing as far as lactation services goes because it's the preventative side of care that we do not get to see a lot of in nursing. And one of the cool things is this starts the health of that child from day one. It helps for lifelong prevention. That mother's milk has bacteria in it, which helps create the microbiome of the gut, which is where a lot of our immunity comes from. So these lactation consultants actually help improve the health of these children. So that's kind of where our passion for this service line comes from. So when you think about the health and wellness of our community, when those dollars go back to helping these moms to support the beginning immunity for life, that means that we are creating a healthier community. So when their donations go to create a healthy community, that means that those taxpayer dollars that go into helping with health care, which we know is trillions of dollars increasing yearly, this is one way that we help to decrease that illness moving forward. As much as we like to think that breastfeeding is natural, it is not always natural for every mom or child. So we like to support women in every way that we can.